Hi, my name is Lindsay Calvin, and I'm with Ascension Medical Devices, where we are developing innovative solutions for transgender health. We know that gender-affirming care drops suicidality from 40% to 1.8%. One of the care options for transgender women is a procedure known as vaginoplasty, or the surgical creation of a vaginal canal. Unfortunately, complication rates with vaginoplasty are around 50%, and it costs over $25,000 to treat these complications. Archaic standards of care are part of the problem. We pack the new vagina with gauze, and we leave it there for 5 days. Once it's removed, the patient is required to dilate 3 times a day for 30 minutes at a time for the first 3 months. Our device removes the burden of compliance barriers for these patients, and it eliminates the severe complications associated. Our single-use flushing stent is placed in the vagina during the procedure. It is replaced once a month for the first 90 days with a larger size to replicate dilation without the high burdens of compliance. Why is now a good time to get into this market? The American Society of Plastic Surgeons have published data showing that the vaginoplasty market is growing at 41%. There were 300,000 vaginoplasties worldwide last year with a market of $1.5 billion. Our device will be purchased by the hospital. We'll sell a kit of 3 for $5,000. We should have gross margins over 85%. Our team is experienced. We have a plastic surgeon on our team and 2 very intelligent engineers, if I do say so myself. And we are very excited to bring this device to an underserved population. Questions?
So first of all, I'm astonished at the market size, of course. So there's going to be one treatment per individual, I guess, with this stent.
Correct.
And I didn't get to see the market size of that, but the first thing I'm thinking, of course, is just the marketing of it. And that's foreign territory for many of us.
So marketing, we are reaching out to plastic surgeons. I personally have interviewed over 50 surgeons that do this procedure. So plastic surgeons, urinary reconstructive surgeons, and urogynecologists, and they're all looking for something in this space. Their options are limited, and they're not happy with the results they're getting. We're also reaching out to patients who have had this procedure done in the past and patients who are looking to have this procedure done in the future because they're really informed and they're looking for the best care possible. This is an expensive procedure. In the United States, it costs over $90,000 to get this. You want this to go well. You only want to do it once.
How many clinicians are in the United States that would potentially use your product?
Right now, there are 53 surgeons in the United States that perform vaginoplasties, and there are about 125 worldwide. I've met most of them. I went to the World Conference for Transgender Health in Argentina, and I've spoken to most of them. They're all looking for something like this. So I can personally reach them, but if I had a sales team, it would go even better.
Is any country in the world sort of more advanced at this than the U.S.? Is Europe, for instance, would that be?
Almost everyone is better at this than we are. We have taken a while to get on board. Argentina actually is leading the world when it comes to transgender rights and transgender healthcare. Thailand does way more procedures than we do. Europe is leading. They have conferences every year training new people how to do this. Belgium has a fellowship. We are just now coming up with a fellowship for the United States.
Wow.
So do you have a prototype?
I do. We have a prototype. We actually did our first cadaver study on Wednesday, and it went really well. So we're looking forward to doing more.